Ashmita, and today I'm making a video about the endocrine system again. But on this video, I'm just going to cover some important aspect of the endocrine system that I have missed on my previous video. So that means my previous video is up for endocrine system. If you haven't checked that out, go ahead and check it out. It's pretty helpful and informative if you're studying endocrine system. Let's start. So let's start with the microalbumin. What is microalbumin? So it's an urine test that we do for our diabetic and hypertensive patients. If you have diabetes and hypertension, then kidney might be the first organs to get hit by it. So we have to make sure kidney health is good, right? So what it does, it usually checks for protein in your urine. So if your kidney is excreting protein, that means your kidney health is not good. If you see like positive proteins on the urine, then you have to do it like more frequently. If they're within the normal limits, then once a year will be fine for both diabetes and hypertensive patients. And yeah, and for our diabetes patient, try to avoid glucocorticoid steroids use. But if you have to use it, just documents the risks and benefits, and educate your patient about like when to see the doctor, about the low carb limits, and etc. And let's talk about the CMP. So if the insurance allows, get their CMP at first, and if their LFTs are within the normal limits, then you can just follow with the BMP. But if their LFTs are elevated, then we have to check for the hepatitis. So if their hepatitis panel is negative, then order an ultrasound to rule out if they have any fatty liver disease or not. If only their AST is elevated, then it could be from alcohol, statins, or Tylenol. So ask your patient about the alcohol history and all that. And if it's fatty liver disease, then the treatment is krill oil, 2 fiber capsules, aspirin, and vitamin E capsules. And recheck their lab in about 3 to 6 months. You'll see like big improvement in their LFTs. Okay, let's talk about the insulin pump. If your patient is on insulin pump, tell them to discontinue their pump when they're swimming, showering, or bathing, because most of the insulin pump, they are not waterproof, and water exposure on the pump can damage the electrical component of the pump, causing it like too much insulin to get delivered or too less insulin. And also the insulin is like very temperature sensitive medication, so hot showers or swimming during the sunlight can damage the pump, degrade the insulin, and of course will be less effective after that. For the DKA patients, if your patient is present with abdominal pain, nausea, vomiting, then could be from DKA. So check their NE and GAP, ketones, and